Hi guys, what is urinary tract infection or UTI? An infection which involves kidneys, ureter, bladder, and urethra, or this urinary system. We call it as urinary tract infection. The most common cause is bacteria. In that, E. coli is very common, which is present in digestive system. The patient usually presents with burning micturition or increased frequency of urination if the lower urinary tract is involved, that is cystitis or urethritis. If the upper urinary tract is involved, such as kidneys, the patient will have loin pain, that is lower back pain, and patient will have fever, chills, and rigors. So upper urinary tract infection, we should consider as complicated urinary tract infection and has to be treated promptly with IV antibiotics. But before that, the history is very important. Uh, how common is UTI? The urinary tract infection is very common in females because of short urethra and its anatomy. Second, when there is a sexual intercourse, this urinary tract infection can happen. Third is uncontrolled diabetes. Fourth is menopause. The female's the estrogen decreases, and this leads to urinary tract infection. Fifth is the patients who are on immunosuppressants such as post-transplant or some connective tissue disorders. Here also patient can have urinary tract infection. So this usually they complaints of burning micturition or fever, chills, and loin pain. Sometimes the patient can also have hematuria. The first thing what we do is, if you're suspecting upper urinary tract infection, we send for urine culture. Or if it's simple urethritis or cystitis, then we can send for urine routine where we can see plenty of pus cells and bacteria, and then we can give a short course of antibiotics. So if it's an upper urinary tract infection like pyelonephritis, imaging like ultrasound, urine cultures along with the urine routine, we will send, and then we will treat with the IV antibiotics. And once culture comes, then we have to adjust antibiotics accordingly. And diabetes with acute pyelonephritis, we always do a CT KUB just to rule out any papillary necrosis, hydronephrosis, or emphysematous pyelonephritis, which are very common in a diabetic, uncontrolled diabetic patients. So this is how we treat. And once the patient has recurrent urinary tract infection, then probably this patient might require a prophylactic antibiotics for a longer period of time. Thank you.